Welcome to the Wellness Protocol, your source for guidance on metabolic health, hormones, and longevity. I'm Dr. Alessia Roehnelt, double board certified endocrinologist, and on each episode, I'll share simple tools rooted in science and experience to help you feel better, live longer, and take control of your health. Welcome back to the Wellness Protocol. Today, we are going completely back to the basics when it comes to thyroid disease and Hashimoto's, because despite how common these conditions are, there is still so much confusion around what the thyroid actually does, what Hashimoto's really is, and why so many people feel awful when they're told that their labs are normal. So if you've ever felt exhausted or you struggled with weight gain that didn't make any sense, if you notice hair loss, dry skin, brain fog, anxiety, depression, cold intolerance, or you just felt like your body isn't working the way that it used to, this episode is for you. And if you've ever been told your thyroid labs look fine, but you know deep down something is off, you're also in the right place. My goal today is not to overwhelm you, and it's not to turn this into a highly technical endocrinology lecture. The goal is really to help you understand what's actually happening in your body in a way that makes sense so that you can feel informed and empowered and advocate a little bit better for yourself. One of the reasons thyroid disease is so confusing is because the symptoms are very vague. Typical symptoms of an underactive thyroid include being extremely tired and sluggish, gaining weight, having mood changes, being unmotivated to do things, brain fog, digestive issues. The problem is these symptoms overlap with so many other things. These can be caused by just stress. They can be caused by burning out. They certainly can be caused by perimenopause and menopause. Sometimes just life, being a busy adult, having a full-time job, having kids. So sometimes it's really hard to figure out whether symptoms are due to a thyroid problem or whether they're due to something else going on in the body. Another problem with diagnosing thyroid disease is that the most accurate number that we use to assess whether or not someone needs thyroid medicine comes in a range. And while your number might fall in the normal range, it might not actually be appropriate for your body. Thyroid physiology is very complex and oftentimes more complicated than just this one single number fitting into a lab normal range. And on top of that, if you have autoimmune thyroid disease, the symptoms of that can actually be present for years before the number even starts to become abnormal. And you may have heard this before, but autoimmune thyroid disease, or more commonly known as Hashimoto's, is an autoimmune condition. It's not just a thyroid problem. In fact, many people with underlying Hashimoto's may go their entire lives without actually developing a problem with thyroid function. But the autoimmune component is always present. And this distinction really matters more than most people realize. So let's start at the very beginning and talk about what the thyroid actually does. The thyroid is a small butterfly-shaped gland that sits at the lower area on the front of your neck. Its influence on the body, however, is enormous. So thyroid hormone plays a role in regulating your metabolism, in energy production, in heart rate, body temperature, digestion, brain function, mood, menstrual cycles, and overall hormone balance. At the cellular level, thyroid hormone tells your cells how fast or how slow to function. So it's really an essential metabolic signal. When thyroid hormone is adequate, cells can produce enough energy efficiently. But when thyroid hormone is low, everything slows down. And that's why symptoms of low thyroid function or hypothyroidism can feel so widespread and sometimes hard to connect back to one single cause. Now, when we talk about thyroid disease, it is important to separate two terms that are often used interchangeably, but really are not the same thing: hypothyroidism and Hashimoto's. Hypothyroidism simply means that the thyroid gland is underactive and not producing enough thyroid hormone. Hashimoto's, on the other hand, is an autoimmune condition in which the immune system is mistakenly attacking the thyroid. Hashimoto's is the most common cause of hypothyroidism in the United States, but they're not identical. You can have Hashimoto's without having a problem with the function of your thyroid, especially early on. And you can have hypothyroidism without having Hashimoto's. Many people eventually do have both. But this is where a lot of people fall through the cracks, because sometimes you may have symptoms of an underactive thyroid, but the TSH is still in normal range. So they're told everything is fine, you don't have a thyroid problem. Meanwhile, the immune system is already causing problems. It may already be attacking the thyroid, or it may already be giving you symptoms. That's why it is often important to check antibody levels, and we'll come back to that in a bit. But let's talk about these thyroid labs, because that's where the confusion really peaks. TSH is often referred to as a thyroid test, but it's actually not thyroid hormone. TSH stands for thyroid stimulating hormone, and it is produced by the pituitary gland, which lies right in front of the brain, just behind the eyes. TSH is essentially the signal that tells the thyroid how hard it needs to work. When the TSH is high, it's basically yelling at the thyroid gland to make more hormone. And when the TSH is low, it's saying, slow down, we have enough, we don't need any more. So TSH is an indirect marker. It doesn't tell you how much thyroid hormone your body's actually making. It's just telling you how loudly the pituitary gland is asking for more. Another common hormone that people might be familiar with is something called the free T4. T4 is the main hormone that the thyroid gland produces. But you can think of it as more of a storage hormone or a circulating hormone. T4 gets converted into another hormone called T3. And T3 is the active form. This is what actually enters cells and drives metabolism. Now, many people are able to convert T4 into T3 very efficiently, although some are not. And when conversion is impaired, we might see a normal TSH or a normal T4, but you may still be having symptoms because you're not getting enough of the active hormone. And then there are the thyroid antibodies, most commonly TPO or thyroid peroxidase antibody and thyroglobulin antibody. These antibodies tell us whether the immune system is at play with regards to the thyroid, whether the immune system is attacking the thyroid. And the presence of these antibodies supports a diagnosis of Hashimoto's. One of the most important things I want you to take away from this episode is that you can have thyroid antibodies and symptoms even when the TSH is normal. Now, that doesn't mean you need thyroid medicine, because if the TSH is normal, most times you're making enough thyroid hormone. You're not going to feel better by adding in more thyroid hormone. But you might feel better if we work a little bit more with your immune system. Now, let's talk a little bit about symptoms, because thyroid symptoms don't look the same in everyone. While some people can be profoundly fatigued, other people have difficulty settling down, or they feel excessively anxious all the time. Some people struggle with weight gain even when they're eating well or exercising, although other people actually are struggling to eat because they have absolutely no appetite. Sometimes you can experience hair thinning or more brittle hair. You can have more dry skin, bowel issues like constipation or bloating. And one symptom I know I get all the time is feeling cold all the time. And my patients have described it to me, and I can describe it to you the same way. It feels like a cold that starts in your bones, and you just can't get warm. I always joke with my husband that the first time it gets really cold in the late summer, fall months, I'm like, all right, well, that's it. I'm going to be cold until July. It started. And it is so difficult for me to get warm. And I will tell you, that symptom of being cold all the time does not get better with thyroid medication. Now, not everyone has every symptom, and symptoms can change over time. And the variability in this is one of the reasons why thyroid disease is often missed or minimized. But when it comes to treatment, thyroid hormone replacement can be incredibly helpful and for many people, life-changing. But it's not as simple as just writing a prescription and moving on. The dose matters, the timing matters. Sometimes the formulation matters. Some people feel better quickly, other people need a lot of adjustments to get to a good place. And when people continue to have symptoms, even when their labs are normal, this is where you really need a broader view of health. It's really critical to understand that thyroid medication does not cure Hashimoto's. It can give the body adequate thyroid hormone. It can help with certain symptoms, but it does not cure the underlying autoimmune condition. So what can help Hashimoto's? Well, this is where lifestyle plays a huge role. When you have an autoimmune disease, a lot of times your body is more sensitive to the environment than other people. And little things may trigger symptoms in you a lot easier than another person. For instance, you might feel that when it rains, you start to feel achy because you're very sensitive to humidity changes. When you're eating certain things in your diet, you feel very inflamed and bloated because you are more sensitive to those things. So you really need to start looking at everything in your environment and what might benefit your immune system versus what might trigger your immune system. Some of the really common things to look at are blood sugar balance. So if you're having really uncontrolled blood sugars up and down, that can certainly affect your immune system and how you're feeling in general. Sleep can play a role. Stress definitely plays a role. Nutrient status, so if you're deficient in certain vitamins or minerals. The difficult thing is there is no single diet or single supplement or single detox program that will fix Hashimoto's. Everyone is absolutely different. Now, I can tell you some of the more common triggers for the immune system when people have Hashimoto's, because that's normally where I tell my patients at least to start. Number one is gluten. Now, just because you have Hashimoto's or a family history of Hashimoto's does not mean you have to take out gluten. But if you are someone that does feel inflamed, your joints hurt, you get a full night's sleep, but you don't feel well rested, if you are just one of those people that are still having symptoms, you may want to try a gluten-free diet. If you do this diet, I would suggest removing gluten completely, 100%, no cheats, removing it completely for 6 weeks. It takes time for inflammation to go down, so we want to give your body adequate time to be less inflamed. So you would take gluten out for a full 6 weeks, and after the 6 weeks, think about how you're feeling. Has anything gotten better? Is your skin softer? Is your hair falling out less? Do you feel less achy when you wake up in the morning? Is your GI tract functioning a little bit better? And if the answer is yes, then I would say gluten probably is a trigger for you, and you should try to keep it out if you can. But if you feel exactly the same, and you're literally like, I just want a slice of pizza, then add it back in, but then try taking out another trigger. The second most common trigger, I would say, is dairy. A lot of people with Hashimoto's are very inflamed by dairy, so that would be another place to start. Once you try gluten or dairy, another common trigger would be soy. And then after that, it really requires a deep dive. You need to look at things like your dishwasher detergent, your hand soaps, your shampoo, your conditioner, your body lotions, everything. Anything that is having contact with your body could be a trigger for you. And you have to do these isolated experiments, one thing at a time, and try to figure out what makes you feel best. Many times, unfortunately, there is not a blood test that is going to tell us this. A lot of times it is about trial and error and listening to your body and figuring out what makes you feel best and what makes you feel awful. Now, I want to end with who should be checked for thyroid disease. If you have symptoms of hypothyroidism, as we discussed, your primary care doctor will probably check your thyroid level, especially if it hasn't been checked in the last 6 to 12 months. That is something that you can ask for, and many doctors will say, yes, that would be a great idea. Let's check your thyroid. Another reason to have your thyroid level checked is if you have a strong family history of thyroid disease, or if you're planning pregnancy or even struggling with fertility, it's really reasonable to ask for an evaluation. You deserve to feel well. So normal labs should not necessarily be the end of the conversation, especially if the quality of life is suffering. Now, I can't promise that your symptoms are going to be due to a thyroid condition. As we talked about in the beginning, there are a lot of other overlapping conditions that can cause the same symptoms as an underactive thyroid. But a full evaluation is absolutely important to really rule in or rule out an underlying thyroid condition or an autoimmune disease. I want to end by saying this. Thyroid disease is common. It's real, but luckily it is manageable. Understanding the basics, like what the thyroid does, the difference between hypothyroidism and Hashimoto's, and how labs actually work, is really the first step towards feeling better. If this episode helped you understand your body a little bit more, I encourage you to share it with someone who's struggling with thyroid symptoms. So many people feel alone or dismissed when it comes to thyroid health, and education can be incredibly validating. Thank you for being here, and I'll see you in the next episode of the Wellness Protocol.